Okay, let's dive in. Picture this. You lean in for, some quality snuggle time with your pet,
Mm-hmm.
and bam, you get hit with this breath that's less than pleasant. Sound familiar?
Absolutely. It's something pretty much every pet owner experiences at some point.
Exactly. So today, we're tackling exactly that.
Yeah.
Pet bad breath. What's really going on behind that smell?
Yeah, and it's important because what we often just dismiss as like normal doggy breath or kitty breath,
Hmm.
it can actually be a real signpost, a clue about their overall health.
Okay.
So we're going deep today, looking at a detailed overview covering causes, diagnosis, and what we can actually do about it.
Perfect. And our mission for you listening in is really to get past that idea that bad breath is just normal.
Yeah.
We want to unpack the real reasons and give you some, practical steps for your pet's oral health.
So first things first, let's define it. When we say bad breath, the technical term is halitosis.
Halitosis, right?
And it simply means an offensive odor coming from the mouth. Now, a lot of people assume maybe it's coming up from the lungs or the stomach.
Yeah, you kind of think maybe it's just what they ate lingering.
Exactly. But the info we're looking at suggests that's usually not the main source.
Okay. So where is it coming from then?
Well, the primary culprit, like the vast majority of the time, it's right there in the mouth, periodontal disease.
Ah, gum disease.
Essentially, yes, driven by plaque bacteria. And this is where it gets really interesting how it develops. It's a step-by-step thing.
Okay, break that down for us, this plaque process.
Right. So imagine your pet's teeth are perfectly clean, maybe after a dental cleaning.
Okay.
Within just 6 to 8 hours, really fast, a bacterial biofilm starts to form, like a sticky, invisible film.
6 to 8 hours, wow.
Yeah, and that soft plaque, if it's left there, it starts to mineralize. Harden up. Within a few days, it becomes calculus or tartar.
That hard yellowish stuff you sometimes see.
That's the one. And as that calculus builds up and kind of ages,
Mm.
it leads to gingivitis. The inflamed gums, redness.
Exactly. Gum inflammation. And if that isn't dealt with, it can progress further to periodontitis, and that's serious. It means loss of the actual structures supporting the tooth.
Okay, so it escalates?
It does.
Yeah.
And there's a really key shift that happens with the bacteria themselves.
Oh, how so?
Well, initially, the bacteria are mostly non-motile, gram-positive aerobic types, the early settlers, if you will.
Okay.
But as the plaque gets older and the inflammation starts, the environment changes, it becomes less oxygenated down near the gums. And this allows a different crowd to move in.
Yeah.
Motile, gram-negative, anaerobic bacteria.
Bad guys.
Pretty much. The ones that thrive without oxygen. The sources mention names like Prophyromonas, Bacteroids, Fusobacterium, Actinomyces. These are the ones strongly linked to established periodontal disease.
And that calculus, the tartar we mentioned, its surface is rough, right? That must make things worse.
Absolutely. It's like a perfect scaffold for more bacteria to stick to. Plus, it physically irritates the gums just by being there.
And then, as this goes on, the little gap between the tooth and the gum, the gingival sulcus, gets deeper. It forms what we call periodontal pockets.
Pockets. Okay. Like little hiding places.
Exactly. Perfect traps for food debris and, crucially, more of those anaerobic bacteria to multiply and break things down. It's a vicious cycle, really.
So ignore the plaque.
Yeah.
And you're basically inviting this whole smelly bacterial party into the gums.
That's a good way to put it. And this brings us to why it smells bad. It's those gram-negative anaerobic bacteria we just talked about. They produce something called volatile sulfur compounds, VSCs.
Volatile sulfur compounds. Okay. Yeah, I'm smelly already.
They really are. These are things like hydrogen sulfide,
Rotten eggs.
that classic smell, yes, and methylmercaptan, dimethyl sulfide, plus some volatile fatty acids. These compounds are the direct source of that really offensive odor.
Ugh. So it's literally the waste products of these bacteria causing the stink.
Precisely. And there's even some suggestion that these VSCs aren't just smelly bystanders. They might actually contribute to the disease process itself. Well, they might damage the gum tissue barrier, making it easier for bacterial toxins to get deeper into the tissues, causing more inflammation and damage, maybe even getting into the bloodstream.
Wow. Okay, so bad breath is definitely more than just bad breath. It's a signal.
A very important signal.
Now, you mentioned periodontal disease is the main culprit, but the overview also hinted it's not always dental, right? What else could be going on?
That's right. While periodontal disease is, far and away the most common cause, sometimes bad breath can be a sign of other things happening elsewhere in the body, systemic issues.
Like what kind of things?
Well, certain metabolic diseases. Diabetes, for instance, can sometimes cause a sweet or acetone-like smell on the breath. Kidney failure, leading to uremia, can cause an ammonia-like or fishy odor.
Okay, so the body's chemistry changing the breath smell.
Exactly. Also, respiratory problems. Things like rhinitis, sinusitis, infections, or even, unfortunately, tumors in the nasal passages or sinuses can create foul odors.
Makes sense. Stuff trapped in the airways.
hmm And then there are gastrointestinal issues. Less common, but things like megaesophagus, where the esophagus is enlarged, or GI tumors, or even a foreign object stuck somewhere, they can sometimes manifest as halitosis.
Right. And diet. You mentioned that too.
Yes, definitely. Some pet foods are just naturally more pungent. And then there's a less pleasant topic of coprophagy.
Eating poop. Yeah, that'll do it.
It certainly will. And even some skin conditions like lip fold pyoderma in breeds with, those skin folds around the mouth. Bacteria can thrive in those folds.
Okay. What about other things in the mouth, but not necessarily gum disease?
Good point.
Yeah.
Yes, other oral issues can cause bad breath too. Things like ulcers in the mouth, maybe problems with tooth alignment, orthodontic issues that trap food, pharyngitis, tonsillitis, oral tumors again, foreign bodies like pieces of stick or bone wedge somewhere. Trauma is another one, chewing electric cords, sadly, or jaw fractures. And various infections, bacterial, fungal, viral within the mouth itself. Even some autoimmune diseases affecting the oral cavity, or a condition called eosinophilic granuloma complex, particularly in cats.
It's quite a list. Really shows you need a proper checkup to know what's what.
Absolutely. You can't just assume.
So, who's most at risk for this? Are certain pets more prone to bad breath issues?
Well, it affects both dogs and cats for sure.
Oh.
But yes, there are predispositions.
Like?
Smaller dog breeds often have more problems. Their teeth can be more crowded in a smaller jaw, making cleaning harder.
Ah, okay.
And brachycephalic breeds, the flat-faced ones like pugs, bulldogs, Persians, and cats. Their facial structure can sometimes contribute to dental issues.
Right.
Also, just generally, smaller pets tend to live longer, giving more time for plaque and tartar to build up over the years. And diet can play a role. Softer foods don't provide the same abrasive cleaning action as, say, dry kibble.
And older cats in general.
Yes, definitely. Age is a big factor. More time for periodontal disease to develop and worsen.
And often, the smell is the only sign, isn't it? Until it gets really bad.
Very often, yes. Owners just notice the smell, but if there's significant oral pain or disease, you might see other signs. Things like excessive drooling, maybe with a bit of blood.
Okay.
Pawing at the mouth, difficulty eating, maybe dropping food, or even a loss of appetite if it's really painful.
Right. Signs of discomfort. So, okay, you've noticed the smell, maybe some of those other signs. What happens next? How does the vet actually diagnose the cause?
Well, it starts with a really thorough history from the owner and a physical exam, paying close attention to the mouth, of course. Often, they'll recommend baseline blood work and a urinalysis. These might be normal if it's just a mouth issue, but they're crucial for ruling out those systemic causes we talked about, like kidney disease or diabetes.
Right, checking the whole picture.
Exactly. But for the mouth itself, a visual inspection only shows you the surface. To really see what's going on, especially with periodontal disease, you need intraoral radiographs, dental x-rays.
Ah, like when we go to the dentist.
Precisely.
Yeah.
Because so much of the problem happens below the gum line bone loss, issues with the tooth roots, you just can't see that without x-rays. And that usually requires anesthesia.
Okay. Are there any other, specific tests for the breath itself?
There are, actually. It's quite interesting. There are industrial sulfide monitors that can literally measure the concentration of those VSCs, those stinky sulfur compounds, in the breath, down to parts per billion.
Wow, high tech. Is that common in clinics?
Not typically for routine checks, it's more for research or specialized cases. But there is a practical test for dogs called the Orostrip Quick Check.
Orostrip.
Yeah, it's a little strip the vet uses in the exam room that detects thiols, another type of sulfur compound from those bacteria, pretty quickly.
Yeah.
Gives an indication of the level of periodontal pathogens.
Oh, neat, like a quick screening tool.
Kind of, yeah.
Yeah.
And then, of course, during that anesthetized dental exam, the vet uses the traditional methods too, using a probe to measure the depth of those periodontal pockets around each tooth, checking how much gum attachment has been lost, looking for any teeth that are loose or mobile. All that information, combined with the x-rays, builds the full picture.
Okay, so diagnosis complete. We know what's causing the smell.
Right.
What's a treatment plan usually look like?
The key thing always is to treat the underlying cause.
Right, not just the symptom.
Exactly. So if it is periodontal disease, the most common reason, then a professional dental cleaning under general anesthesia is usually step one. This involves scaling to remove all the plaque and calculus, both above and below the gum line, and then polishing the teeth.
Okay, what if the disease is really advanced? You mentioned tooth support loss earlier.
Yes. If a tooth has lost too much support, the guideline mention is often more than 50% bone loss around it, then extraction, removing the tooth, is often the best and kindest option.
That sounds drastic, but I guess if the tooth is just a source of infection and pain.
Precisely. Removing it resolves the infection and the pain associated with that specific tooth. It's about improving the pet's quality of life.
Makes sense.
And a huge part of this whole process is client education, making sure you, the owner, understand that halitosis means something's wrong, that assessment under anesthesia is often needed, and that prevention at home is crucial moving forward.
Right. Prevention is key. What does that look like?
The gold standard really is brushing daily, or ideally twice daily brushing or wiping of the teeth.
Daily brushing. I know that sounds daunting to a lot of people.
It can be, but it's incredibly effective. That mechanical removal of plaque before it hardens is the best defense.
Okay. So brushing is number one. What about the professional cleaning itself? What does that involve beyond scaling?
That full assessment under anesthesia includes the probing, the x-rays we talked about, the scaling and polishing, and then deciding if any extractions are needed based on everything they find.
Gotcha. Now, what about medications? Do antibiotics help with the bad breath?
It's an important point. The information emphasizes that antibiotics are generally not the primary fix for halitosis itself.
Oh, okay.
The main goal is controlling the periodontal pathogens through the cleaning and then the home care. Antibiotics might be used in certain situations, maybe for severe infection before or after the dental procedure, or sometimes to help manage really deep pockets along with home care, but they aren't a substitute for cleaning and brushing.
Right. Address the source, the bacteria buildup.
Exactly. Don't just try to suppress them temporarily with drugs.
What about all those other products? Dental chews, water additives, gels?
Yeah.
Do they work?
Some can be helpful, yeah, as part of a plan. Nothing replaces brushing, but some things can supplement it. For instance, certain plaque retardant gels applied weekly can help slow plaque buildup, and products containing metal ions, especially zinc, are interesting. Zinc can actually bind to those sulfur compounds.
The VSECs.
Yeah. It forms insoluble zinc sulfide, which basically neutralizes the odor. Plus, zinc has some antimicrobial effects and might interfere with calculus formation too.
So it tackles the smell and maybe helps with bacteria.
To some extent, yes. There's a specific topical gel mentioned zinc ascorbate cysteine that apparently works quite rapidly to reduce the smell.
Good to know there are options. And follow-up, I assume that's important?
Crucial. Regular veterinary checkups, including dental exams, are needed to monitor things and catch any recurrence early. And sticking with that home care, the brushing or wiping is absolutely fundamental.
So consistent effort is key.
Absolutely. Daily prevention and regular professional care.
Okay, so once treatment is done, and assuming good home care, what's the outlook? What can people expect long-term?
Well, the prognosis really hinges on the underlying cause.
Makes sense.
If it was, say, early-stage gingivitis or mild periodontal disease, and the owner becomes really diligent with home care, the prognosis is generally very good. You can manage it well.
Okay.
But if it was due to very advanced periodontal disease with significant bone loss, or if there was an underlying systemic issue like kidney disease, then the prognosis is more guarded. It depends on managing that primary condition and preventing further dental deterioration.
Right. Depends on the starting point and the ongoing commitment.
Exactly.
Okay, let's try and wrap this up. If there's one main thing our listeners should take away about their pet's smelly breath, what would it be?
I think the most critical point is don't ignore it. Pet bad breath usually signifies an underlying health problem. Most often, it's periodontal disease driven by bacteria. It's not just a cosmetic issue, it's a health issue.
Right, that smell is a warning sign.
Definitely. Think of that rotten egg smell. It's literally the waste product of bacteria damaging your pet's mouth. It needs attention.
So being proactive is essential. We talked about brushing. Any quick tips to make that daily routine maybe a bit less intimidating for owners?
Yeah, absolutely. Start slow. Get your pet used to you just handling their mouth and lips first. Then maybe introduce a finger brush or soft cloth with just water. Use pet-specific toothpaste. Human ones are not safe. Make it positive, lots of craze, maybe a small treat afterwards. Build it into a routine. And consistency is more important than perfection. Even brushing a few times a week is way better than nothing. Wipes can also be an alternative if brushing is really difficult.
That's great advice. Keep it positive, make it routine.
Exactly.
So Listener, maybe next time you notice your pet's breath, think beyond just the smell. Consider what it might be telling you about their hidden health. Focusing on their dental care really is a big part of their overall well-being. Definitely something worth chewing on, wouldn't you say?